Hey, it's Dr. Kelly from Iowa Family Chiropractic. Something that we talk about often is how chiropractic care can help with pain during pregnancy. Helps you sleep better, feel more relaxed, more energy, all that good stuff. But lesser known is how chiropractic care actually allows for you to have an easier labor and delivery because of fetal positioning. So I want to kind of show you what I'm talking about and show you how chiropractic care helps with this, because it's a mystery to a lot of people, but we actually know the truth. So here's a spine, here's a pelvis. Here is the inlet where your baby goes through here and then comes out, right? Now, we all know that babies are supposed to be head down. So baby's supposed to be head down inside your pelvis just like this. Now, when you are getting adjusted, the goal of an adjustment isn't to move your baby or anything like that. So let's say you have a breech baby where baby is like this, okay? So they're just like that, kind of sitting with their butt inside your pelvis. We don't actually try to move the baby. We work on aligning mom's body. So mom's body, we have our sacrum, that's the triangular bone back here. The uterine ligaments actually attach to the sacrum. So if the sacrum is pulled back on one side, it's going to pull on the uterus unevenly, and it can actually make it so that your uterus goes into a shape like this, kind of oblong, instead of nice and round and open like it's supposed to be. So a baby will end up going into whatever is the most comfortable position. So if baby's getting squished, they might go into a position that's less than optimal. Now, sometimes moms come in and they're like, my baby's head down, but they're sunny side up. Or it's a brow presentation. So there's lots of different presentations. This baby, we have the cranial bones marked out on here, so that's why it looks like this. So with a brow presentation, for instance, that means the baby's head, their front of their head is contacting the mom's cervix instead of the back of their head. So it's supposed to be presenting right here where this part of the baby's head contacts mom's cervix and allows for dilation, okay? And then what happens is when the baby's head down and they're getting contractions, this is happening, okay? And this is a natural motion for a baby's spine. Now, let's say that there's a brow presentation. Now you have this happening to a baby's spine. That is not a natural position for a baby's spine to be in. So babies that are born via brow presentation, they can still be born vaginally, but it's really, really hard on that baby's neck. So also why babies need to be checked after being born. Now, if you have a breech presentation, that's when the baby's kind of sitting like this inside a pelvis. So you can see how this baby is sitting with its butt down. Babies can be born vaginally this way, but you'd have a hard time finding a doctor that will allow you to have a breech vaginal birth in a hospital. So we want baby to turn around. And we do that just by working on mom's body, by doing adjustments, working on ligaments, and allowing for mom's body to open up, her uterus to actually open up, so baby will naturally go into that head down position where they're supposed to be. So the cool thing is chiropractic adjustments actually decrease labor times by up to 50%, which is amazing, because it allows for proper dilation, proper contractions, and the uterus will actually contract downward and push baby out. If the baby's not in that perfect position, it'll actually make it so that contractions aren't as effective, maybe dilation doesn't happen when it's supposed to, and that's when doctors start wanting to do interventions to get the baby out. So chiropractic care is absolutely essential during pregnancy to make sure you have the best experience, but also to make sure that your baby has the best experience and the best entry into the world. If you have questions for us, send us a message, talk to your doc here in the office. Thank you so much for listening and have a great day.